In the United States, nearly a quarter of our multi-generational families have a family member working in a job that they never trained for, they never asked for, and they've never been paid for. That job is the informal family caregiver. It's estimated that there are 34 million Americans providing care for older family members and friends. They're drawn in primarily by a sense of responsibility and a pressing need. For activities of daily living, which we often take for granted, like feeding and bathing and toileting, success actually requires mobility, strength, balance, and normal mental capacities. But the truth is that as we age, many of us lose the ability to care for ourselves. And as we do, family members step in to fill the gap. But they do so at a great cost to themselves. How much cost? Well, if we were just looking at the dollars, on average, in a recent study of 1,000 informal family caregivers, the annual cost was $5,500. And if you were caring for a family member from afar, let's say from another state or a distant community, the average cost was $8,728 per year. Where'd the money go? Well, it splits up evenly into four pieces: direct medical expenses, household items including food, extra help and travel, and home repairs and basic day-to-day equipment. More specifically, 42% of the respondents in this study had paid for household goods or food in the past year. 39% had funded transportation. 31% had covered the co-payment costs of an elder's drugs or medical payments. 21% had purchased clothing, and 13% had paid for home improvements. Where does the money come from? Well, half of the family caregivers cut back on hobbies, leisure activities, and vacations. 1/3 dipped into their savings and deferred major purchases for themselves. 1/4 cut back on their own groceries and seeing their doctors to cover the costs. It's not surprising then that informal family caregivers, isolated in this complex world, overwhelmed and lacking system support and financial aid, often become sick themselves as they struggle to do the right thing. Here's a quote. "Typically, when people talk about services for caregivers, they mean respite care, support groups, and things like that," says Gail Hunt, who's president of the National Alliance for Caregiving. She goes on, "They don't think of the financial side being tied into the burden." Now, Mrs. Hunt's organization teamed up with United Health Group's Evercare division to complete the study above, and they were able to detect a significant drain on family income in many of the caregivers. 37% of them, predominantly women aged 40 to 65, reduced their own work hours and income or quit their jobs. And the lower the income, the more financially vulnerable the helper. For example, those with an annual family income over $75,000 devoted an average of 23 hours a week themselves, while those with incomes of less than $25,000 a year put in 41 hours a week. Now, couples are especially vulnerable. A careful study in 2006 examined the health status of couples who encountered chronic illness. Out of 500,000 couples between ages 65 and 98, 74% of the males and 67% of the females were hospitalized at least once between 1993 and 2002. 49% of the husbands and 30% of the wives died during the study period. And quite strikingly, there was the fact that a large number of the surviving spouses died within a year of the loss of their loved one. The mortality rate was more than 6% among the men and 3.5% for the women. The fate of surviving spouses, many of whom were primary home-based caregivers for their ill loved ones, emphasizes society's need to provide better social network support for family caregivers. As Harvard aging experts Dr. Nicholas Christakis and Paul Allison say, quotes, it is clear that a person's illness or death can have health consequences for others in his or her social network. This observation in turn means that efforts to reduce disease, disability, and death can be self-reinforcing, since a decrease in the burden of these events in one person can have cascading positive benefits for others. Healthcare might indeed be more socially efficient and more cost-effective than is suggested by looking at individual cases alone, close quotes. That's true, according to Gail Hunt of the National Alliance for Caregiving, but she believes we've reached a point where dollars must follow as well. As she says, quotes, "If you're spending 10% of your income, that's part of what's weighing on you, and policymakers haven't paid enough attention to that," close quotes. For Health Commentary, I'm Mike McGee.